G'day, it's Jason here from Coffs Total Chiropractic. We've got a short video for you today with some of the skills and drills you need to be able to look after your low back when you lift and bend. It's part of the tradies 10-minute guide to a stronger low back without having to go to the gym. If you don't have the guide, you can go to www.coffstotalchiro.com.au and you can download it there. The first step in developing a strong low back is learning how to use it correctly. That is finding the safe position, which is also known as the neutral lumbar spine. We're doing this in my lounge room here today, which is one of the recommendations in the guide, that you do it in the lounge room before you go to work of a morning. Make sure your low back's warmed up, ready to go when you get to the job site. First step to protecting your low back is finding the safe position, the neutral lumbar spine. We're going to lay on our back, knees bent at 90 degrees, feet are flat on the floor. So first step is we're going to roll the low back into the floor, then we're going to roll the hips into the floor, lift the low back up off the floor. We're going to repeat several times. So that is showing us the extremes of movement where the low back is generally more vulnerable. The safe position is in the middle where you have a little bit of that lumbar curve. Once we have identified that position, basically you want to learn where that is while you're lying on the ground. Then we're going to learn how to hold it. So to hold it, we need to activate the core muscles. To do that, we're going to pull the belly button into the spine. We're not going to suck the gut into the chest. Basically, when you get it right, pull the belly button in, you'll feel these muscles on the side pushing out a little bit. So one extra little tip to getting this right, so that you do protect your low back, keep the load off the discs when you are bending and lifting. When you found the lumbar neutral position, okay, come into the middle, you've pulled the belly button into the spine, you can feel the muscles on the side activating, you can feel them coming out. We don't want the low back to then push down onto the floor. We want to make sure that little gap is being maintained as the belly button is being pulled into the spine. The hip hinge is a skill we need to be able to bend and lift safely without putting any pressure on the lumbar discs. That way you keep your low back safe when you're lifting and bending. To do that, we want to find the safe position, the neutral lumbar spine that we learnt while we're laying on the ground earlier on. To do that, while you're standing, you're going to roll the hips back, push the low back, flatten it, then arch it forward. Then in between, hopefully remembering the position that we learnt while we're lying, pull the belly button in, and from there we're going to use the broomstick to develop the movement pattern to help protect the low back. You put the broomstick on the back of the head, back of the middle back, on the tailbone. Find that neutral lumbar spine, rolling the low back back, forward, in between, tighten the belly muscles. From there, we push the hips back, stick your butt out and tilt forward. We're going to keep our legs straight in the beginning, which is quite an exaggerated movement, but the reason for that is we're developing the skill, trying to develop some muscle memory so that when we get back into the real world, we can bend and lift safely. The hip hinge is a drill that allows you to develop the coordination you need to be able to protect your low back when you're lifting and bending on the job site. It's not an exercise as such that will improve your mobility or strength. There are those available in the Tradies 10-minute guide to a stronger low back without having to go to the gym, available at www.coffstotalchiro.com.au, where you'll find other information on how to look after your back as well. The other things you can do, you can send me an email, j.patterson@coffstotalchiro.com.au. Leave your contact details, I can give you a call and we can answer any questions you have, any other information you might need in regard to your particular case. Or third thing, call the clinic on 66524025, make an appointment and we can start on a plan to get your low back recovered today.